Hello, everyone. Thanks for tuning in. This is Kelvin Choi from the National Institute on Minority Health and Health Disparity, Division of Intramural Research. Today, I'm going to talk about the trends in cigarette and smokeless tobacco use by first responders. Before I start, I want to acknowledge my co-authors, T. McNeil and Ben Jewett, for helping out on this project. And also, I would like to point out that the comments or opinions expressed in this presentation are my own, and they do not necessarily represent those of the US government, the National Institute of Health, and the National Institute of Minority Health and Health Disparity. So if you have questions, you can email me, and I'm going to give you my email address at the end of the presentation. So a little bit of background. We have seen previous data, mostly cross-sectional study, looking at the tobacco use in first responder occupations, and also compare those to the tobacco use prevalence among general adult population. And we have found in those studies that first responders are showing a higher preference of tobacco use. As tobacco use in US adult decline over time, it is unclear if the first responders also share the same trend, because there's no reason study that actually look at the trends in first responders tobacco use behavior. So that's why we conduct this analysis, is to look at how the smoking behavior and also smokeless tobacco use behavior change over time among first responders, and also compare that to the US adult non-first responder population. To do that, we use data from the tobacco use supplement to the current population survey collected between 1992 to 2019. This is a representative US sample that is attached to the current population survey, collected every 3 to 4 years. And every wave, there were about at least 100,000 participants in the survey. So it gives us a good sample size that we can look into different occupations. In this survey, they asked about current use of cigarette and smokeless tobacco. They also asked about other tobacco products, but their sample size are a bit small for those, and so we're going to focus on cigarette and smokeless tobacco use. In terms of occupation, participants reported their occupation, and so we went through the list of occupational code and to identify folks who reported as a firefighter, and those reported to be in law enforcement. Those include police, sheriffs, bailiff, detectives, correctional institute officers, and jailers. We also have a small number of people reported they are in the military. Now, please note that the tobacco use supplement to the current population survey is actually a survey of US civilians, so we're not capturing a big number of military, but we do have some of those in the survey, so we're going to look at that. And then for other occupations, those are people who are in non-first responder occupations. That include folks who are working at an office job or in retail or different environment. Now, it does exclude people who are in other first responder occupations that include, for example, lifeguards and paramedics. We have codes for those people, but they are in smaller number that we're not able to actually look at those. So let me show you some of the data here. Let me first orientate you to the graph and what they mean. Each component actually represents different things. For example, the grayish, the yellowish, brownish color, sorry, I should pick a different color, actually shows the prevalence of cigarette smoking over time among non-first responder US adults. Each dot represents one data collection cycle. As you can see, they're spaced out fairly evenly 3 to 4 years apart, except in 2000 and 2001 that they were collected consecutively in 2 years. And we estimated the trend over time, and the adjusted odds ratio shows that at 0.98, which means that over time, every year, there's a 2% reduction in odds of the US adult non-first responder population to be current smoker. So the blue dots and the blue line represent the data for firefighters. And we estimated that actually there's a significant decrease in the trends of cigarette smoking among firefighters. And the decrease is about 5% per year in terms of relative changes. We also estimated in 2018 whether the preference of smoking between firefighters and non-first responder US adults are different from each other, which we found that firefighters are actually less likely to be smoking cigarettes compared to the non-first responder US adults. So overall, this graph shows that there's a decreasing trend over time parallel between the firefighters and non-first responder US adults, and that firefighters are actually less likely to be current smokers compared to the US adult who are in non-first responder occupation. This slide shows similar data, but now we look at law enforcement folks. And the orange line represents those who work in law enforcement. And the dotted line is the linear trend that we have estimated. It shows that there's also a significant decrease in smoking among law enforcement over time. It's about 3% relative decline per year. Now, when we compare the prevalence of smoking in 2018 between the law enforcement and the non-first responder US adult, we found that there are slightly lower among law enforcement officers, but the difference are actually not statistically significant. So it shows that, again, the law enforcement officers actually have a decrease in the trend of smoking, and they are smoking at about the same rate as the non-first responder US adult population. Military is slightly different. Now we have data for the military folks since 2003, so we start from that point. And the sample size is, as I mentioned, is fairly small because the survey is supposed to be US civilians. We see a slightly disturbing trend here because, as you can see, the blue line represents those who are self-reported in the military, and they are actually showing a slight increase in the trend of smoking, while the rest of the population is showing a decrease. Now, we try to estimate the time trend, and the time increasing trend is not statistically significant, probably because of the small sample size. And we also compare the prevalence of smoking of the last time point in 2018 between military personnel and those who are non-first responder population. And we also did not find a significant difference, although the odds ratio is like a 3.13 here. So let's turn our attention to smokeless tobacco use. And again, we'll first look at firefighter. Now, as you can see from the graph that the prevalence of smokeless tobacco use is lower than that of cigarette smoking. So we were looking at before 20-30% prevalence, and now we are looking at something more like 2% to around 10%. So the blue line represents the firefighters, once again. And for the other occupation, we actually see a slowly, very slight decline that is actually not significant. So I'm not going to mention too much about it, but it has steady remaining in 2% for the non-first responder US adult population. When we look at the firefighter, what we estimate is that there's actually a 3% relative increase every year for firefighters in terms of the prevalence of smokeless tobacco use. So there's a significant increase in smokeless tobacco use among firefighters. And when we compare the prevalence of smokeless tobacco use between firefighters and non-first responder US adult, we actually found that firefighters are actually more likely to be using smokeless tobacco compared to the US non-first responder adults. Here we look at smokeless tobacco use among law enforcement officers, which is represented by the orange line. And over time, we have a significant, although very small, 2% increase in relative increase in the prevalence of smokeless tobacco use among law enforcement officers. But when you compare the prevalence of smokeless tobacco use in 2018 between the law enforcement officer and those who are non-first responder US adult, law enforcement officers are actually more likely to be using smokeless tobacco. So again, it's similar to firefighters, that firefighters and law enforcement officers are actually more likely to be using smokeless tobacco product. So in conclusion, we found that cigarette smoking prevalence among firefighters and law enforcement officers declines over time, and the declines is similar to non-first responder labor force. Cigarette smoking in military seems to be increasing, but we have a small sample size, so we need to look at surveys that actually have majority of military member to see if this increasing trend is actually replicated there. Smokeless tobacco use is increasingly common among firefighters and for law enforcement officers too. And they both have a higher rate of smokeless tobacco use than non-first responder labor force. So I think this brings to the point that there's a need for effective intervention to reduce smokeless tobacco use among our first responder, particularly among the the firefighters and also law enforcement officers. Thank you for listening. This is my email is at the bottom of this slide. I'm sorry that I can't join you guys in person. If you have any questions, you can always reach out to me through this email address. And now I'm going to turn it over to Katie.
Okay, thanks, Kelvin. So Kelvin shared tobacco use data for military and first responder populations. And I'm going to talk a bit more about first responders, and then Kim is going to talk about military. So NIH's data show that while cigarette smoking among first responders is decreasing at the same rate as the population as a whole, smokeless tobacco use among law enforcement and firefighters is higher than the general population, and rather than decreasing, seems to be increasing, especially among firefighters. My presentation is going to cover some of the tobacco industry tactics targeting these populations, and I will also share some thoughts on potential strategies we could focus on to reduce those high rates. While California as a whole has the second lowest smoking rates in the nation, rural California has much higher smoking rates. Our project, STAND, which is Small Town Allies Against Nicotine Dependency, is part of a larger initiative in California to address high rates of rural tobacco use. Police and fire departments are part of the backbone of rural California communities. And having worked in tobacco control in rural communities for a few years, a tobacco control advocate will typically have to confront two things. One, police chiefs are often opposed to new tobacco restrictions because they see it as an unnecessary drain on their strapped resources. And two, that police and fire departments in rural communities are very likely to have a culture of tobacco use within their departments. For these reasons, we decided to start focusing on this often overlooked population of tobacco users. So we started looking at rates of tobacco use among first responder populations and found high rates of smokeless tobacco use as shown in the data. This is some of the same NIH data that Kelvin just presented. I just put together the rates of smoking and the rates of smokeless among firefighters into one graph, so you can see the declining rates of smoking at the same time that smokeless rates seem to be increasing there. And when we pull apart rates of smokeless tobacco use among rural versus urban firefighters, we can see that the rates of smokeless tobacco use among rural firefighters is much higher. And you can see the general population, the two bars over there on the right-hand side, and then the firefighter bars over there. You can see that even urban firefighters are using smokeless tobacco rates at higher rates than the general population in rural areas, and that firefighters in rural areas are using smokeless tobacco at much, much higher rates. If we want to understand why rural first responders and California populations have higher rates of tobacco use, one of the pieces of the puzzle is the tobacco industry and the tactics that they are using to target first responders. One of those tactics is shown on this slide here. You can see Police Chief Hopper in the popular show Stranger Things on Netflix. Tobacco industry infiltration of the media has a long history and is demonstrated conclusively in the Tobacco Industry Documents Archive at UCSF. Here we see that they're trying to connect tobacco use with rural first responders, and for anybody that's watched this series, you know that this character here ends up being the hero of the whole show. Another tactic is to offer special promotions and discounts, which are typically bundled for military and first responders to receive free samples, discounts, and special products just for them. Studies show that pricing and discounts are a major contributor to tobacco use, especially among younger people and people with smaller income. There are also special clubs and specialized products available, such as these dip can covers, special mud jugs for spitting, and even first responder loose leaf tobacco product. In fact, the biggest player in electronic vaping devices has caught on to this special population and has created a special website just for them. You can find it at heroes.juul.com, but don't expect to get very far. They are doing a good job at keeping tobacco control advocates out of their special website by using a service called ID Me to verify military and first responders through their ID credentials. We have been able to sign up using IDs from our friends and colleagues and have started to receive some of those special promotions in our emails, including a Juul starter kit for $1. The ads shown here are all for smokeless tobacco, and if you go and search in the Stanford University Tobacco Industry Marketing Archive, you will find that when it comes to first responders, the industry specifically markets smokeless tobacco to them. Here you can see them connecting their products with bravery, determination, and with being a part of the brotherhood of users of their products. And you can see in the middle ad that they're connecting in that rural identity as well. Finally, the tobacco industry also tries to make connections with rural communities through special events, such as this First Responder Appreciation Day, and through donations and corporate responsibility campaigns, such as by donating fire trucks to fire departments and by giving away these four-wheel drive vehicles to fire departments. Okay. So rates of smokeless tobacco use are high and potentially increasing among first responders, and the tobacco industry is part of that rise. But what can we do to address this issue? The first thought is to address tobacco use in the training process of first responders. For both police and firefighters, there are 3 basic steps to becoming a professional. The first is to attend community college. The next is to attend a boot camp style academy training. And finally, they receive field training within their new department. More and more community colleges across the nation are becoming smoke and tobacco free. And in California, a little more than half of the 114 community colleges in the state are completely smoke and tobacco free. And continuing this, especially in rural areas, is going to be important to reducing first responder tobacco use rates. As far as the academy stage, I don't know of any lists or compilations of police and fire training academies and what policies they have regarding smoking and tobacco use on their campuses. But I do know from talking to a chief at one of the large CAL FIRE academies here in rural California. CAL FIRE is our wildland firefighting agency, that their campus is not smoke and tobacco free, and that they do see quite a bit of smokeless tobacco use both inside and outside of the classrooms. And then for the third stage, field training, this is potentially where new recruits are most susceptible to tobacco influences, as they are newly minted professionals trying to figure out their new identity and how to fit into their new department. So this leads us to department policies. A study in 2012 conducted focus groups and interviews with firefighters across the US to find out more about the decline of cigarette smoking and the rise of smokeless tobacco use among firefighters. Among other findings, the authors note that department policy change regarding smoking was a major contributor to both the decline in smoking and the rise of smokeless. One interviewee noted, "It was a gradual shift. It wasn't a sudden shift. You could see how it came out with the policy. At first, you couldn't smoke in the common areas, only in the Bay areas, and then you can't smoke in the Bay areas. You could only smoke outside, and now it's you can only smoke 50 feet from the door." So through these interviews and focus groups, you can see how these policy changes were behind a larger cultural changes in the profession regarding smoking. Given this knowledge in tobacco control, it might be a matter of expanding department policies to include smokeless products in their policies, basically to learn from their own successes. Like, your department used to have high rates of smoking and policy changed that culture. Now do the same thing for smokeless tobacco use by establishing a tobacco-free department rather than just a smoke-free department. I don't have to tell anyone that's here today that that's much easier said than done. And that part of the issue here is the lack of awareness of the harms of smokeless tobacco. So that wraps up my section on first responders, and I'm going to hand it over to my colleague Kim, who is going to take a closer look at tobacco use among military populations. Thanks.
Perfect. Thank you so much, Katie and Kelvin. So today I'm going to just share a little bit about military tobacco use specifically, and also really focus in more on how the tobacco industry continues to influence use within active duty service members as well as veteran communities. So my name is Kim Homer-Vagador, and I'm with an organization called the California Youth Advocacy Network, and we're a statewide training and technical assistance agency in California working with youth and young adults who are engaged in tobacco control work. And we have been working with military communities since 2005. In 2004, the California Department of Public Health published a study, California Active Duty Tobacco Use Survey, which found that military community members in California had significantly higher rates of tobacco use than civilian populations. And in 2005, our agency started Project Uniform, which stands for Undoing Nicotine Influence from Our Respected Military. And our work really focused on trying to support active duty military installations in California in providing culturally appropriate tobacco treatment services to service members, as well as work with public health advocates and community health professionals to provide tobacco treatment to veterans within our communities here in California. And this work continues, although not at the same level that it has in the past, but we're continuing to work specifically with colleges and universities to make sure that student veterans have access to culturally appropriate tobacco treatment services on their campuses, specifically because many of our schools in California are going smoke and tobacco free. And so I do just want to note, Kelvin shared this, and I think it's important to really emphasize that tobacco use rates in military communities, both active duty and veteran communities, are higher than civilian populations. And that rate does look different based on military service and the branch of service. So we know, for example, that Marine Corps, the Marines have the highest rates of tobacco use, followed by Army, Navy, and Air Force. And that's really critical in the work that you do with the branch of service. I also want to share that those who are younger in their service, as well as enlisted service members, have higher rates than older service members and officers. And so when we're focusing our prevention and our treatment efforts, we really need to be cognizant of reaching that young adult population within the military. And then also similar to active duty, we know that veterans have higher rates of tobacco use. And just recently in 2018, close to 30% of veterans reported past 30-day use of tobacco products. So there are numerous factors that contribute to military tobacco use. One is the culture. And this is actually something that we spend a lot of time talking to service members about, that this isn't by accident. It's very much influenced by the tobacco industry that has created this culture for using tobacco, which is what I'm really going to be focusing a lot of my talk on today. Again, as I mentioned, branch of service. So there are branches with higher rates of use than other branches. Deployment. So individuals who have been deployed in conflict and the conflicts that they've served in impacts their tobacco use. So men and women who have served in active conflicts and have been deployed have higher rates of tobacco use than those who have not been deployed. Of course, the industry tactics that continue today. And then we also know that individuals who have substance use disorder or other mental health conditions have higher rates of tobacco use. And then finally, looking at veterans, that transition into civilian life can be very stressful. It's also a time where tobacco use may increase. It's also an amazing opportunity for us in public health to be supporting individuals who transition from active duty to civilian life as veterans, and supporting them in quit attempts and providing them with access to tobacco treatment services. So from here, I really want to focus on what has the industry been doing. The industry, as Katie has shared, past and present, looking at Juul and some of their new efforts to reach out to military community members. But the industry for a long time has done a lot of work to not only addict service members to their products, but also engage individuals of influence and power within the military to try to prevent strong public health policies and make sure that tobacco use was part of military culture. So for a long time, the industry really has advocated that specifically for service members, that tobacco use is a right, that service members should be able to use tobacco. They've also worked very hard to keep tobacco prices low for service members. And so when many policies that we have that try to increase price with tobacco taxes are implemented into our communities and into our states, those prices do not impact the price of tobacco on military installations. The industry has also been notorious for giving out free samples of tobacco products and even sending products and rations to service members overseas. And then, of course, similar to what Katie just shared with first responders, the industry has a long history of supporting military-specific events like concerts and fairs and rodeos or other places where military members attend. They give away their products and branded items and really are encouraging use. And then, of course, the industry has been using targeted ad placement in newspapers. They do storefront advertising in PX and commissaries. And then, of course, in military communities. I know here in California, we have a large presence of military community members in San Diego, and there's a lot of industry advertising and marketing specifically for military members. So just looking back at what the industry has done at the federal level, I do want to note that while the industry has done quite a bit to interfere in federal policy, the Department of Defense has also done a lot to try to prevent and treat tobacco addiction within all branches of the military. So just looking through this list, you can see that Department of Defense has, since the 1980s and prior, has tried to implement some strong tobacco control policies to prevent initiation and addiction of tobacco use among service members. And there's a couple on this list that I want to point out specifically. Looking more recently at in 2014. In 2014, the Secretary of the Navy, Secretary Mabus, he tried to implement a strong policy that would ban the sale of tobacco on all Navy and Marine Corps installations. And unfortunately, that sales policy was blocked in Congress. And there was language that went into the Defense Spending Act that did not allow for that to be implemented. And so that was an example of how Department of Defense and the Secretary of Navy tried to implement strong public health policy and then was blocked by lobbyists within Congress and individuals within Congress who were being funded by tobacco industry influence. And then in 2016, another example just from California, where we had a Tobacco 21 law that was passed. Right before the law went to the governor's desk to be signed, somebody somewhere stopped that from including military personnel. And so military personnel over the age of 18 were exempt from California's Tobacco 21 law. Fortunately, that was closed with the recent federal law, and now that policy applies to all individuals under the age of 21. But it goes to show that the industry has interfered in public health policy and will most likely continue to do so. And so as Katie mentioned, there's a lot that we can do with first responders and with active duty service members to try to prevent initiation. We look at trying to work with boot camps to make sure that there's good prevention information included, quit information included, and that can continue after. But oftentimes, because our military installations are federal, it's difficult to do state-specific or even local-specific policy work. And so our efforts have really focused on supporting service members and veterans in quitting their tobacco use. And again, this is an area where the Department of Defense has really shined. DoD has a great campaign called You Can Quit Too, and it's a national campaign that is really focused on supporting service members and quitting. And the VA likewise has great tobacco treatment services. They're very comprehensive, they're very expansive, and they're culturally appropriate. And so what we can do at the local and at the state level is really, again, support the work that Department of Defense has been doing and really reach out to service members in our community to support those quit attempts and also to help motivate those quit attempts. And the more we can educate our communities and veteran serving organizations, as well as active duty service members, to let them know of industry influence in military tobacco use, the greater our work will be. So if there's any additional information I can provide, this was just a snippet of the role of industry influence in military tobacco use and the work that we can be doing, again, to prevent and to support treatment of service members and veteran tobacco use. This is my contact information, and we do have a website with some great resources for those working with military communities and those interested in learning more about how tobacco impacts military community members. Thank you for your time.